I'm not even sure if I don't start Ooca, I would still be living right now. Healthcare is harder, like at least 3 times harder than like, I don't know, like other stuff. I think first thing first, you have to feed yourself with a lot of knowledge. Conservative, not willing to try something new. It's mental, I would say. We became the industry standards. I would rather like not having one than having a bad one. No.
Hello, we are in Bangkok, Thailand, and I'm really excited about our first episode in 2023. I'd like to introduce our today's guest. Her name is Doctor Eix. Hi.
Hi.
Before we get to talk more about the startup you're founded and you're managing right now, tell us a little bit about your background and how did you get into health tech?
Okay. So my name is Eix, or Kanpassorn Eix. Usually, like Thai name is so long and you would need a nickname, so just call me Eix, that's easier. So I am a trained dentist. I actually graduated as a dentist maybe like around 10 years ago. And then after I served in the army for like around 2 years, I decided I want to start this startup called Ooca. Back then I didn't even know about like what startup really means. But what I want to do was that I see that there's a huge problems about mental health in the country. And me, myself, I was also a patient. Even though I'm also a part of the healthcare system, I'm also a healthcare professional, I struggle to find help. Yeah, it's really hard especially when you're not working in a very convenient environment. I was working like far away from Bangkok, and I had to see a psychiatrist in Bangkok. I had to travel like long hours, like 6 hours before being seen, and also about the stigma around the issue. So I feel that there could be a good use of technology to try to fix this problem. So that's where I start everything. Yeah, back in 2017, I officially like found Ooca and officially launched the app in 2018. So basically, it's a telemedicine focusing purely on mental health.
And you mentioned you struggle to find help, and you mentioned the geographical reason. But if we take the country overall, are there any problems like lack of professionals in this area as well?
I think it's the same issue around the world, depending on the variation of the degree. Even in countries like in the US and the UK, you still have issues with not enough resources, not enough psychiatrists, not enough psychologists. It takes a lot of time to produce one. And it's goes the same way here in Thailand, but the degree is much larger. I think there's one psychiatrist per 80,000 numbers of population. So yeah, we do not have enough resource, and most of them stay in the larger city, in a larger city, in Bangkok or in I don't know, in countries where you have university, like Chiang Mai. Yeah, so like elsewhere, it's very hard. Maybe you have like 1 or 2 psychiatrists in the whole province. Yeah.
Okay, we'll definitely talk a lot about Ooca, but before that, wanted to ask you, can you give like a very brief intro into the Thailand healthcare system overall, like how it works, other hospitals, private or public, how the general system works?
So the system in Thailand is, I think our system is quite unique. We have very much proud system called universal healthcare, that every Thai people can have like free access to medical care service in public hospital. And so we have a lot of, we have more than thousands of public hospital all over. Territory type of hospital, like large hospital, node hospital, secondary hospital, and also including like smaller nodes like a care center station in the rural area. So I think in terms of infrastructure, Thai public healthcare system is very I think it's very well supported in a sense that it's not too far away for a public health, but it will be some issue if you have a more complex situation that needs to be referred, or you live in a very rural area like up in the mountain and you have to go down and get some help. Yeah. And also, but at the same time, we have very strong private sector in hospital services as well. We have a lot of major healthcare conglomerates, healthcare hospital chains. One hospital chain in Thailand, the largest one, the largest hospital chain in Thailand is called BDMS, and it's actually the top 3 largest hospital chains in the world. Yeah, so like both on the public side and on the private side, very saturated, I would say. Yeah, and
what about insurance? Is it something common in Thailand when people basically insure their health?
Insurance, I would say this is an interesting point. You don't really buy insurance comparing to the West or comparing to a more developed countries like in Hong Kong. Yeah, the percentage of the buyers comparing to those countries is like maybe you have to divide by hundreds.
Right. Okay.
Yeah. So there are insurance, but how we got covered are not usually the private insurance, but more on the scheme like universal healthcare scheme. More than 80% of Thai people, Thai citizens are covered. They are already covered by the universal healthcare, and they could go to any of the public hospital and get the service that they need. But of course, sometimes it's not fast. Sometimes you have to wait long time. But comparatively, when you compare this kind of service in the US or even in the UK, like I would say Thai service is much faster. I understand that in the US or in the UK, it's very hard for you to get into the emergency room. But for Thailand, it's very easy. You just walk there and you need someone, you want someone. You can actually like wait for some hours and you'll be seen by someone. It's not very much seen in the West. Yeah.
That's good. That's good for sure. Actually, I found some stats which amazed me since I just didn't know that. Multiple resources say that Thailand has been in the top 15 countries with the best healthcare systems over the past years.
Yes.
Like in 2021, it was in the 13th place. In 2019, it was on the 6th place worldwide, which is a fantastic accomplishment.
Yes.
What's the secret of the success? What do you think?
From moving up, right, up to the 6th. I think it's because of the whole system that we already have between, and also the infrastructure. I think in terms of medical industry, Thai people is pretty advanced, and also with the use of technology, I would say that everything is seamless. Or anything, like as a Thai person, the grass is always greener on the other side, and also there's a lot of issues in terms of politics issue, management, people wanting to saving face, people doing it for popularity or whatnot. But Thai citizens kind of push hard when it comes to their health and their security. We talk a lot. We rant about how things work, how things do not work. So that's how I think that somehow indirectly pushed the government to try harder to be the best. yeah, but there's a lot of things that me as a Thai person that I don't really feel that is fair. It's about the distribution of vaccination and also how we manage the vaccine. This is poorly managed. Yeah, we get the vaccine. It shouldn't be. We shouldn't buy those type of vaccine like those. We should actually try to pursue for mRNA vaccine from the beginning, and it should be managed more effectively. Yeah, that's the part where I disagree.
I see.
Yeah.
Actually, I was going to talk a little bit more and ask about the pandemic, and I can see that people around on the streets, supermarkets, restaurants, most of the Thai people are still wearing masks.
I don't wear masks.
You don't wear masks?
I might be the wrong person, but
it's not mandatory, right?
It's not mandatory.
It's a matter of choice.
It's mental. I would say, where like people still felt like it's a courtesy for you to respect someone by wearing masks. And Thailand is a very conservative country. We like to go by the rules and everything. And we tend to do more than need. So that's why you probably see a lot of people keep on wearing their masks. I disagree. I think we should stop. In a certain circumstance. Yeah.
Well, yeah, right now, I mean, when everyone is reading news about China and like the number of people got infected,
yes.
It's crazy. So
yeah, it's crazy. But at the same time, Thailand is a country that heavily depends on tourists coming into the country, right?
Right.
There has been very poor standard accepting Chinese tourists. Like, there's Chinese tourists coming in, and you probably need to have some control over that. Like some other country might have some protocols like, hey, if you're Chinese, you gotta have like the negative result on the test. But somehow for Thailand, we have to protect ourselves. We have to wear masks. You guys come in. I'm like, what? No. It's just my point of view.
I see. Okay.
Yeah.
Well, let's talk a little bit about digital health here in the country. Do you think the government and general population are fast in adopting new technologies?
Yes. I would say that Thai people are easily influenced. And I think one of the unique things about Thai people is that we are very much we are very into new things like the social media. We have one of the largest population that use Facebook, Instagram, top countries, and we use it heavily, including Twitter as well. So it
TikTok.
TikTok. That's true. So you see that we are heavily consuming new things, news, and also technology all the time. So if there's something that one certain group of people are actually using it and became hype up or something, it kind of spread around quite easily. And when it comes to digital health, the reason why it became easier for people to adapt to is because of the ecosystem that has already been built, like the financial tech. Thai people, we are mostly cashless. We do everything online, very easy, like Shopee, Lazada, pay everything online. We are very familiar with that. So when all of the basics are already there, and healthcare is something on top, people adapt much sooner than, I don't know, maybe other places of the world, I guess. And since I already mentioned that Thai healthcare industry is quite saturated, very competitive, a lot of these private hospitals or even public hospital, they try to compete. They try to be number one all the time, and they bring a lot of technology into the hospital, and it eventually push to the customer that, hey, there's new things going on. Maybe you want to try this and that. And of course, initially, these hospitals, they do not really understand the importance or the capacity of health tech because they made money mostly from people coming
in-person visits.
in person. Yeah, but at this point, I kind of see more that health tech is actually adjunct to what they already have and would eventually drive more revenue.
So, Ooca, tell us a little bit more about the startup. And it's been, 5 years?
5 years.
For the company. What were the ups and downs for the startup?
Ooca is a telemedicine focusing on mental health. We do things that are like two niches at the same time. First one would be telemedicine because, people are not getting, hey, like, why telemedicine? Yeah, it's something that's quite new. Like right now, not so new anymore, but still it's not like mainstream.
Right.
And the second thing is mental health. Mental health is also considered a niche back when I started. Still pretty much a larger niche right now, but still considered a niche. So it's quite hard to make people understand the capacity of the market that it could have been or it could become. And especially in a country like Thailand, people are very conservative and also like not opening up about like mental health that much comparing to the West. But we have been very progressively opening more, discussing about mental health. I think comparing to the rest of the other countries in Southeast Asia, I think Thai people are by far like more progressive, like more openly discussed about the matter. And also a lot of things are happening around mental health, like a lot of online clinics opening up. Yes, more competitors, but also like more people helping, educating people about mental health and also changing the perspective. Because when like one of the obstacles for doing this kind of business is the fact that some of the provider will not understand. Some of them will be like, hey, these things are not taught when they were in school. Like, why are we doing this? They're not like very much approved. They don't want to do this. But then COVID comes, boom, you have to do it no matter what. But even though like after 2 years, some of them will be like, hey, let's go back to the office. Let's go back to the clinic. I'm like, it's not completely black or white. I think it could complement each other. You could be like on site at a clinic, and also you could be online when things are hard to get, when it's easier to access and you just need a bit of touch up. It's better than some level of care than none, in my opinion. So the down times would be like when I started, it's so hot. Yeah. The ups would be, okay, people are getting more, people are picking up more. But I think there's a lot of more room to grow in this area. It's not like it's just the beginning. So Ooca has this model where, okay, so just generic population, anyone that would like to book appointment, download application, book appointment, talk right away. So you don't have to wait. 0 time of waiting. Somebody is online right now. So definitely there's a good chance that you're being helped faster through Ooca platform. And also we have the B2B side where we provide service to companies. Right now we have around 65 companies as our clients. We help promote good mental well-being in workplaces. So the staff, the employees are being helped faster and supported by the company, making the company see the actual value of mental health. I think that's important. And also the third part where it's more like social impacting. Ooca co-found a foundation called Wall of Sharing with Ministry of Health, Department of Mental Health, Child and Adolescent Mental Health Institution, Ratchanakharin, in which this institution manages the 1323 hotline. 1323 hotline is like a healthcare hotline or a suicidal hotline. They have unmatched numbers of calls that they could actually pick up, and the lines that they couldn't.
Always busy.
Yeah, that's always busy. Ooca co-create like we co-found this foundation together while sharing like these type of beneficiaries, the middle school students, high school students, university students, all of these people could access Ooca for free through wall sharing. It would be supported. So during we have done this for 3 years now. We have helped for around 2,000 cases. Still not a lot in my opinion. It could be much more than this. With some of the difficulty communicating within the department itself. But I think next year will be a lot better since we are officially a foundation right now. Also, it takes a lot of time setting up a foundation. We've been trying to do to set up this foundation for 3 years. It takes 3 years. So long. We just found it last month, I think.
Well, congrats that you finally did it.
Yeah. Thank you.
Going back to 2016, 17, when you just got the idea, and I assumed you were studying for a dentist, and you were not a tech person.
Yeah.
Did you need some kind of tech partner who will tell you how we're actually going to develop this app, what kind of programmers we need, how we're going to create the UI, UX and stuff like that? How did you solve that issue?
I think first thing first, you have to feed yourself with a lot of knowledge around the things that you're trying to do and you don't understand. My initial learning curves would be when I try to understand something and I book a session of discussion with a software house agency. I go and I just do not understand anything at all. They're actually not teaching me anything, actually. They were a lot of jargons here and there. But you have to learn. What is it that you don't understand? You have to try to understand. There's plenty of resources available on the internet. You have to know what you need. You might not know at first, but eventually along the way you know that you're lacking of something and you have to fill that gap. You have to try to fill that gap. So it's not only about a tech founder that you have to have. It's great if you can get one. Right now, I still don't have a tech co-founder up to this point. Yeah, it's a miracle that I could actually start and continue doing it until now. But it would be nice if you have someone. But if you don't, you have to try to understand it yourself. Or even learn some level of coding so that you actually know what you're talking about when you talk to the programmers. Yeah.
That's, at the same time, it's insane and amazing that you did that in a good way. I mean, that you did that all by yourself, basically, without actually adding some tech partners or founders, whatever.
I would want a founder. I would say I would want a tech co-founder, but it's so hard to find someone that you're actually compatible with, and also to actually find the CTO that could actually communicate well. I don't know. Have you tried to set up a startup before?
I did.
You did? Yeah. Do you have issues with the CTO? Can you get along well?
we can now, but it's I understand what you're talking about. It's definitely a problem for many, many startups.
Yeah, they have to be able to communicate well, speak well, manage well, not using emotion. Yeah. I think there's a lot of good developers, but there's not many good CTOs. So I would rather not having one than having a bad one. Yeah.
That's a great statement. In terms of right now, do you have an in-house team of developers?
Yeah.
How big is the team? Are they located here in Bangkok?
Actually, I have one technical lead, more senior, and there's one junior, and the rest we outsource. We have at least 3 outsourced partners. But this is the structure we are having right now. Actually, we have finished another round and we are scaling. So we are trying to build the in-house. Yeah. So it has been switching around a lot. So initially we were trying to build in-house and it didn't work. We had to change the structure into something like this, some one core guy and then outsource, and then we raise more money and then we have that we have the capacity to hire more and build a great team.
Do you think at some point, I don't know, next year, 5 years, 10 years, you'll say, okay, we're really good in what we do right now in working with mental health problems. Do you think you're going to add other specialties of doctors to the platform, or it's going to be sharp focus on mental health always?
It's going to be focusing on mental health. I don't think if we are not like raising like billions of dollars, it's not wise to do so.
Okay.
Yeah, we have to focus.
Is the company profitable right now?
We were profitable last year, but this year we inject more. We do more, invest more. So this year we're not profitable.
Can you share some numbers in terms of the user base? How many doctors you have on the platform?
We have around total of like hundreds of psychiatrists, psychologists, clinical psychologists, and counseling psychologists. In terms of the whole user is around, I think right now it's almost 200,000.
Oh, nice. That's great.
Yeah. But more money are actually coming in from the companies. So the company right now that we are providing service to is 65 companies.
My next question was about the accessibility and affordability. Like, I think the consultation depends on the time, like around from $30 to $50. How affordable is that for general population?
There's a variety of choices on the app. I think the cheapest one is like 600 Thai baht. 600 Thai baht is like what? Almost 20?
Yeah, a bit less than.
Yeah. I would say that it's okay for like middle class, to pay. The more expensive would be like 1,800 1,800 Thai baht. Yeah. Which is around like 60. So I don't know, comparatively for upper class. But like what I said, we have another segment for those that need help but does not have resource, like the students. So it could be supported through wall sharing. Yeah.
Okay. And how hard is it to find doctors for the platform?
How hard?
Yeah.
To get doctors on the platform? Initially it was very hard. Like conservative, not willing to try something new, not willing to be tied to something that's quite unsure, do no harm. So initially it was very hard. But as we grow and we gain more credibility, we became the industry standards. So it's easier for them to understand. I think all the doctors, all of the psychiatrists knows about Ooca.
But they still need...
It just depends on them whether or not if they want to join.
Right.
We haven't even tried to push that hard on like recruiting the provider, but I think next year I will do more. Yeah.
Do you still validate like the doctor when the doctor comes to the platform?
Yes.
How do you do that?
So we check the backgrounds of the candidate, whether or not if it's the degree is validated, or like what kind of degree that they actually get. Because for doctors it's not too hard, but it's harder for the psychiatrist, the counseling psychologist. It's harder because there's no license here in Thailand. You cannot get a license because there's no license available. So you have to actually look into the curriculum that they actually graduated from. Is it legitimate or not? And then they go into rounds of interview. Yeah, like preliminary check about the idea. Like, hey, do you actually understand about counseling, about mental health? If they're kind of like, this is more on the doctor side. If they're a kind of doctor that, hey, I just want to come in and just like prescribe, then it's not who we are looking for. So the vision or the mindset has to match. And then in the next round, we pass them through. We have our standardized tests interview with our psychiatrist or psychologist, so that can actually like see if, hey, the skill set is matched.
If you had a chance to go back 5 years ago, would you still, I assume that the path was pretty complicated.
The path.
The path.
Okay.
Your journey, your startup journey was pretty complicated. Would you, and if you had the chance to start over again 5 years ago, would you still do it?
That's tricky. I don't know. It is so stressful right now. I do not know. What already happened had already happened. I'm not even sure if I don't start Ooca, I would still be living right now. Yeah. I don't know. I think it's a path, like not only just like my self-satisfaction or anything, but along the way, I learned more about myself. Along the way, I actually cured my depression. Yeah, but I cannot say. I don't know. Yeah, that's really hard. Maybe. Yeah, maybe.
Do you miss being a dentist?
No.
Okay, thanks for the truthful answer.
Yeah, not really. Not like, hey, I want to do like dentist all day. No, but there's some field of work that I really like. I really like surgery. That of course I really miss. Yeah, there are some patients that still ask whether or not like if I still do if I still treat patients, because the treatment that they got from me is like better. Yeah, there's still like some moments that I kind of miss that moment because I was actually the person who performed. Yeah, but it's not like I want to do that every day. It will be like maybe if I grow older and I have more time, maybe I want to do it like once per month. But like not every day.
All right. At the very end, I ask my guests to give some kind of recommendations to other startup founders in digital health, and I assume your experience is so unique with all this, everything happening for the past 5 years with your company. What would you recommend to other startup founders to do or not to do in order to be successful?
What to do or what not to do?
Maybe some mistakes that you did and you think, oh, don't do this mistake, or otherwise.
You have to think harder why you want to become a founder. Yeah. What drives you to become a founder? Do you do it for the money? Do you do it because you think you can raise like easy funds from VC? Is that the truth? What do you want out of like setting up a company? Yeah, you have to be clear about that question, because at time it will come back to you. That's what I think. Apart from that are like all the very common things that people usually get, fail fast, like don't regret a mistake, like those things I think you guys already know. Yeah, but I think like if you want to do something, it should be something that 10 years is still the same thing. Like my vision with Ooca after 5 years, 6 years is still the same thing. Is it changing? Shouldn't be something that changes too fast, and especially if you're working in healthcare. Healthcare is harder, like at least 3 times harder than like, I don't know, like other stuff. So be patient.
Yeah, that's important. I think you've accomplished really a lot for this past 5 years, and I'm sure you're gonna have more and more great accomplishments, and can't hear more about that.
Thank you so much.
Thank you for the interview. Bye-bye.